Of the show for today. We're talking to Dr. Husseini, who is giving us some information in reference to African-American disparities across the state of Tennessee, dealing with some major health issues. And of course, Dr. Husseini, let's see if we can pick up where we left off the last time, dealing with African-American health disparities, and then move on to the national health policy and some of the other things that you like to talk about.
Yeah, in order to understand where how does this impact us directly, what I did was to narrow this whole focus down to what is happening in Davidson County. Mm-hmm. As you know, Davidson County is the mecca of healthcare industry. Okay. You got across the street from, if you look at the map, you will see where the population is, where TSU is, where HCA is located, where Vanderbilt is, where Meharry is. HCA and TSU are just about a mile apart. That's the biggest healthcare
disparity and
corporation available to us. And if they could work on that issue, help us to work on that issue, that will be really of great help. In order for us to really work in this area, what I did was to break down our morbidity rates for heart attacks and congestive heart failure and stroke in the Davidson County by zip code for both African Americans and for whites. Where do the people live and what is happening in those zip codes? So if you look at the first map on the heart attacks, you will see that in the zip code of 207, 208, 209, the rates are higher.
Okay.
This is where the black community is concentrated.
207, 8, and 9.
207, 208, 209. Tennessee State is located in 209.
Okay.
Meharry is located in 208. And this 207 is a corridor that goes all the way up. Okay? And you find a higher rate compared to other areas in the Davidson County. Similarly, if you look at congestive heart failure, you again find it is 207, 208, 209, which are predominantly showing higher rates. And if you go down finally to stroke, okay, you find again in the same three zip codes. So what does that tell us? Where are the people going to go? These, according to the census, 2000 census, these are the very low income to middle income neighborhoods. Okay? And it is also aging.
Okay.
So there are two factors that are combined here. If you combine these two factors, you're going to see that certain diseases are going to be more prevalent
Very good.
in those segments of the population. Now, Metropolitan General Hospital is located in 208.
Okay.
That's where Meharry is. If you don't have enough funding for that, for those doors to remain open, where are these patients going to go?
Good.
So Metro government should be really looking at it, because this is evidence-based. This is evidence-based policy-making decision that people have to, policymakers have to look at where is the mortality coming from, where are the people sick, where do we need to provide services. I am right now trying to develop, in collaboration with other colleagues at Meharry and at Vanderbilt, help them to develop a program to offer services in these three zip codes that we are talking about, where we find a high prevalence of cardiovascular diseases and mortality.
So you think that we can actually cut down on the disparity if you start concentrating? In other words, we've not even concentrated on the issue where the problem really is. Is that what you're saying?
We have not really concentrated in terms of providing services to those areas. Because it is an access issue. how do we access these services? If they are too far away, or if the doctors are gone after 5 o'clock, when the people who need the help, where are they going to go? Who do they see? So consequently, what we find here is the men, and especially